ninth part of our RRB MCQ series. So here again we are going to further discuss some important questions which are relevant for RRB and have been previously asked in the release examination. So let's begin with the first question of this part. So the first question says filtration at the glomerulus. So filtration at the glomerulus is influenced primarily by what? Which phenomenon? So the first option says blood pressure in the glomerulus. Option B says erythropoietin. Option C says water reabsorption in the tubules, and option D says vitamin D. So there is no direct connection of erythropoietin with the filtration. Say vitamin D has also no direct relationship with the filtration part. Water reabsorption in the tubules is also not linked with the filtration part. But blood pressure in the glomerulus, like afferent or efferent, if there is certain fluctuation, if the efferent is higher or efferent is lower, then filtration rate get changed significantly. So the answer will be, I guess, answer will be A. So let's see that explanation part. So glomerular filtration depends mainly on glomerular hydrostatic pressure. Higher pressure increases filtration across the glomerulus membrane. So yes, the answer will be A. Moving to the second question. So the second question says heparin is an anticoagulant drug used for the management of clotting by which mechanism? So heparin is an anticoagulant drug, we all know, and used for management of clotting. But heparin works on what mechanism? So this question want to ask us that. So the first option says converting platelets to blood clot. No. Second option says conversion of fibrin to fibrinogen. Option C says inhibiting the conversion of prothrombin to thrombin. And option D says inhibiting the conversion of fibrin to fibrinogen. So we all know that the main function of heparin here will be inhibiting the conversion of prothrombin to thrombin. It does not work on the mechanism that it does not stop directly the fibrin to fibrinogen. So let's see what says the explanation. Heparin enhances the antithrombin 3 activity which prevent conversion of prothrombin to thrombin. So this is how, or this is the mechanism on which heparin functions. If you want to learn more about the anticoagulation part, we have made a dedicated video on the anticoagulation where we have discussed all the mechanisms which are involved. So I will request you to watch that video, or I will also put the link of that video over here somewhere. Like, moving to the third question here, it says the potential for hemolysis and vessel wall damage is great if the pre-pump arterial pressure reading is allowed to exceed. So when will hemolysis or vessel wall damage mainly happen? If the pre-pump arterial pressure reading will exceed what value? So option A says more than minus 100 mmHg pressure. Option B says less than minus 50 mmHg. Option C says less than 250 mmHg, and option D says less than minus 150 mmHg. So the minus indicates the negative pressure here. So the answer will be less than minus 250. So if the pre-pump arterial pressure becomes too negative, and that is too beyond minus 250 mmHg, it can cause hemolysis and damage of the blood vessels due to excessive suction. Moving ahead to the fourth question, it says the counter current multiplier mechanism of the nephron is what? So the counter current mechanism, if you all know, you have studied in the physiology part, we have to tell what is that mechanism in the nephron, so where it is. So the first option says distal tubule and collecting duct. Option B says proximal and distal tubules. Option C says loop of Henle and vasa recta, and option D says glomerulus and Bowman capsule. So we all know it is loop of Henle and vasa recta. So the C is the right option. The counter current multiplier system that concentrates on urine operates between the loop of Henle and vasa recta in the medulla region. So what is the function of this counter current multiplier? So it generally concentrate that particular area. So if this is the loop of Henle, so we have to maintain a certain osmotic gradient, concentration gradient, where deeper we go in the loop, the concentration will be higher, and higher we go, the concentration will be lower. So here it will get more concentrated, and that is because of the counter current multiplier mechanism. Moving ahead to the fifth question, it says which of the following is not filtered into Bowman's space. So in the Bowman space, which of the following will not be filtered? Not here is really important. So the first option is protein, option B is water, option C is sodium, option D is chloride. So we all know the size of the protein is higher, so it is not going to pass in normal scenarios. So large plasma proteins normally cannot pass through the glomerular filtration barrier, so they are not filtered into the Bowman space under normal conditions. They will only pass when there is some disorder with the kidney or disorder with the nephron. Moving ahead to the sixth question, it says which one of the following factor is not a biomarker of AKI? So we have biomarkers given in the options, and we have to find which one is not a biomarker of AKI. So the first one is interleukin 18. Option B is neutrophil gelatinase associated lipocalin, that is NGAL. Option C is interleukin 6, and option D is kidney injury molecules. So this is, by name it says it is a biomarker of acute kidney injury, and so is NGL. It is also a very common biomarker of AKI. You might get confused between interleukin 18 and interleukin 6. So I want to say that interleukin 6 is not a biomarker of AKI. Interleukin 18, NGAL, and kidney injury molecule are recognized biomarkers of AKI, but interleukin 6 is an inflammatory marker and not a standard AKI biomarker. This is a factual answer, and you must remember it. So whenever they will ask the biomarker of AKI, like this time they have asked which is not a biomarker, maybe next time they can ask which one out of the four option is a biomarker. So you have to remember IL-18, NGAL, and KIM-1 also. Moving ahead to the seventh question of this part, it says reabsorption and secretion take place in which part of the nephron? So we have to tell where reabsorption and secretion take place in nephron. Option 1 is tubules, option B is interstitium, option C is glomerulus, and option D is Bowman capsule. So the right answer will be tubules. Mostly reabsorption and secretion occurs in tubular part. It can be PCT, it can be loop of Henle, it can be DCT or collecting. Reabsorption secretions of solute occurs mainly in renal tubules, and renal tubules can be PCT, DCT, loop of Henle, collecting duct. Moving ahead to the eighth question of this part, it says which one of the following is recent advancement in hemodialysis. So we have to tell what is the most recent advancement in hemodialysis. So option 1 says redesorbent system, option B is arteriovenous shunt, option C is wearable artificial kidney, and option D is Hero-Graft. So what will be the right answer? Well, VAC system is very quite common right now. So the answer will be variable artificial kidney, that is VAC. Variable artificial kidney is a recent technology advancement aimed in providing portable dialysis machine. This has to be, this is kind of GK question related to dialysis. Also, Hero-Graft is one advancement, but most recent, I guess, will be VAC system. Moving to the next question, it says incidence of urinary tract infection, that is UTI, in women is higher than men. So the rate will be higher in females than compared to males. And what will be the reason? So the first option says the ureter Ureter is shorter. Option B says urethra is shorter. Option C says the urinary bladder is smaller, and option D says the kidneys are smaller than the man. So this is wrong. Like, this is not relevant actually. Urinary bladder is small. This is also wrong. Urethra is significantly shorter in women compared to the males, and that is why they generally get infected with UTI more commonly. So the answer will be urethra and not the ureter. Urethra is shorter. So females have shorter urethra, making it easier for bacteria to ascend into the bladder, increasing the UTI risk. Moving to the next question. It says if a blood compartment pressure in a dialyzer is 250 milli mmHg and the TMP is 325 mmHg, what is the dialysate pressure? So we have four options. It is a calculation based question actually. If you know, you can solve it easily. So the first option says minus 75 mmHg, that is negative, means negative pressure. Option B says 575 mmHg, it is positive pressure. Option C is also positive pressure, that is positive of 75 millimeter Hg, and option D is minus 575, that is negative pressure. So how we do the calculation here? So the calculation part generally is performed by the formula is TMP, like here it is mentioned also. TMP is equal to blood compartment pressure and dialysate compartment pressure, and they both are subtracted from each other. So likewise in the question they have also given that they have given the value of TMP. So the TMP here will be 325, and what else they have given? The blood compartment pressure they have given. So blood compartment pressure, we have to put the value over here, 250 minus, let's say it will be X. So what is going to happen? We have to subtract it. So what we are going to get? We are going to get 75, but this is of positive, while here we have negative of X. So this negative sign will go here. So it will be minus 75, and this will be our answer. So that's how it is done. So this was all about the ninth part. Hope you enjoyed. Make sure to like these videos, because your like give us very much motivation for making more such videos. Make sure to like and also share it with your friends. The practice sheet for this part will be available in the Telegram group, so do join that group also. Hope you like this video. Thank you. Have a nice day.